Welcome, Heather.
Thank you so much, Steve, and happy lunch, everybody. Well, for those of you in the Eastern time zone, at least. I'm excited to be here with you today, and I'm excited to be sharing some of my findings from my dissertation, and to be doing so with my partners, two of my partners at least, who participated in the research and who I have some insights to share about. So I'm really glad at least some of those partners in research are able to make it today. So thank you for that. I wanted to just start. So the title of this webinar is a bit more general than my scholarship, which was specifically around mental health and substance use. But I do think that our findings are, whether they're directly applicable or the insights would have salience to other sectors, I certainly think that at minimum they'd have salience, and it would be worth considering how these insights might translate into another sector who's really focused on implementing complex systems change. However, in the mental health sector, we've had real difficulty making headway to reduce the burden of mental illness and addiction and improving mental health. And this is despite having a clearer and clearer picture about the problems that contribute to mental health and substance use concerns and the burden it is actually contributing at a societal level. It's despite having better evidence about effective services and supports that prevent, intervene early, and treat people at risk of or experiencing mental health and or substance use problems. And it's also despite increasing attention by policymakers across sectors. We've seen in the last 15 or 20 years that there has been a stark increase in the number of countries and jurisdictions within countries who have mental health policies specifically, and also policies targeting specific subpopulations such as children and youth. So, as someone who's interested in understanding how evidence can inform systems change, you can scratch your head a little bit at this, because obviously the evidence is doing its job informing policy. It's doing its job around service structure design, but we're really not making traction in terms of outcomes for people, and that's what really matters, obviously. And so part of what drew me to doing this as part of my dissertation is that I was really interested in unpacking the implementation process, and to see if more effective implementation could contribute to more effective outcomes for citizens who are experiencing a mental health or substance use concern, or their family members. So really, I think we've been falling down a little bit when it comes to implementation. And hopefully this scholarship contributes a little bit to understanding how we might think differently about implementation and what factors contribute to its success. I just wanted to mention before I get into my insights that I really tried to take an interdisciplinary approach to my thesis, and I tried to think about implementation from three different perspectives and three different lenses. So first, I tried to look at implementation using insights from political science, and specifically the public management literature. And so that lens on implementation is really a policy lens. And the goal of implementation from that perspective is about realizing policy decisions. I also drew from what in Canada we call knowledge translation. In some other countries, it might be called knowledge mobilization or dissemination. But also, there's some conceptual overlap between that and the following term, implementation science. But just to be clear, when I'm talking about knowledge translation, I'm really talking about looking at the implementation process from the lens of research evidence. So trying to get research embedded into policy and practice with the goal of improving its use in those settings. And then finally, implementation science, which again, as I mentioned, has large conceptual overlap with knowledge translation. But in general, I would say the traditional approach in the implementation science field has been really looking at implementation from a practice lens. And the focus has been about creating improvements in the delivery of services and interventions within service or practice settings. And obviously, research contributes to how you could create improvements, but also, you would draw here on innovations and co-design as ways that you might improve a service setting. So my first insight, I thought I'd just start with one of the observations I made fairly early on in my study of intermediaries. And by intermediaries, I mean programs or services, so not usually individuals in my scholarship, although the literature writ large sometimes speaks about individuals as being intermediaries. But in my research, intermediaries are programs or organizations who are supporting the implementation of evidence-informed policies and practices at scale in systems. So that's not just doing it within an organizational setting, but looking at trying to implement an evidence-informed policy and practice across settings at a systems level. And usually that systems level also relates to kind of a contained policy area. So that could be a state or a province or a country, most commonly. So my first insight when looking at partnering with intermediaries to do this scholarship was that they existed in different places and systems. And I've listed the 6 that these mental health intermediaries in my study existed and still exist today. So that can be service delivering organizations such as hospitals or community services. They can exist as an actual program in a government setting, which is true. When I was doing this study in Scotland, they were doing quite a bit of work to support implementation using a quality improvement lens, and it was a team within the actual government. Then there are agencies of government, quite often quality councils or agencies might be intermediaries doing the work using the definition I described for an intermediary. Non-governmental organizations are additional settings. Peak organizations, those are organizations that represent the interests of multiple organizations, usually to another level of government, as an example. And then academic or research settings, which is where you would guess that some of those intermediaries that are focused on the implementation of research exist. So the next few insights are that I'm going to tell you about come from a study that I did looking at examining the puzzling variation in the system placement of intermediaries supporting mental health policy implementation. And this study had both descriptive and explanatory goals, and I used a comparative case study approach and purposively sampled intermediaries in 3 jurisdictions: New Zealand, Ontario in Canada, and Scotland in the UK. I didn't do interviews for this study. This was a preliminary study, and I focused on published literature, public documents, and some key informant interviews, informal key informant interviews, using my integrated knowledge translation approach with individuals who are participating in the International Initiative for Mental Health Leadership. In terms of analysis, I did qualitative content analysis and drew from institutional theory. So my second insight relates to some of the results that I found with this study, which is that intermediary placement can be explained by the institutional landscapes created by the legacies of past policies in these 3 different jurisdictions. So in Scotland, we see a health system and a mental health system that has mainly public service delivery. In Ontario, it's mainly private, although it's not for profit. And in New Zealand, there's a mix of both public and private service delivery of healthcare. This can explain why you might see, as you do in Scotland, why an intermediary might exist in government versus not existing in government. If you have primarily public service delivery, it makes sense logically that the capacity to support improvements in service would also exist in the same setting. However, it doesn't explain why you might see variation across other settings. So that can tell you something about whether you might see an intermediary in government or not. But if it's not, it doesn't explain where else you might see that capacity. For that, you have to look at administrative capacity, which here I drew on Paul Pearson's scholarship, where they talk about administrative capacity both being around the existing capacity of government that has been built on past policy decisions, as well as the skills and expertise of individuals in particular settings. So those past policies both change the structural relationships amongst different actors and systems, but they also affect who has what capacity where in a system. And based on the policy legacies in Ontario, what you see is there's actually quite a bit of capacity in the service delivery sector, both in terms of the ability to receive funds fairly easily from government because of the private not-for-profit arrangement that we have in Ontario, and also because of the role that they've traditionally played in systems, they have generated a bunch of human resource type capacity and expertise that could support things like implementation. In New Zealand, however, the administrative capacity has not been kind of focused in the service delivery sector. And instead, what you've seen is an NGO sector that has really developed from a grassroots way, but at the same time has been enabled by government decisions in the past to start flowing them funds to provide mental health and substance use services. And so over time, New Zealand has created capacity both administratively as well as, again, people power in the non-governmental sector. And that is where you see the intermediary exist there. So this study was really helping us understand where you're likely to either build intermediary capacity, or if you're studying existing administrative capacity, why you will find it, where you might find it. My second study where I'm going to draw some insights from is was a follow-on to that first study, where I did an examination of current implementation efforts and the intermediaries that support them. And in this study, I used 3 countries again, but 2 of the same from the first one and 1 different. So this study, I examined New Zealand, Ontario, and Canada, and Sweden. And I was specifically interested in exploring how policy implementation is structured and the use of intermediaries and the methods that they use in large, well-developed mental health systems. And here the goal was to explain whether and how the features of the political system affect how implementation is structured and the strategies that are used. So I had both descriptive and explanatory goals again. I think part of what's really interesting with intermediaries is there just isn't clear descriptions in the literature about them. So when I was participating as an employee of an intermediary in the early days and helping to build it, we did look to the literature to try and understand what should we be building? And there wasn't at that stage a very clear description of what the intermediaries are, how they function, and what strategies they employ. So part of the goal of this study was just getting a clear description of the intermediaries in these different systems that were supporting the implementation of mental health policy improvements. And again, I used a comparative case study approach. And this time I did site visits with a lot more intensity around semi-structured interviews, as well as publicly available document analysis. And again, I used directed content analysis, and I drew from 2 existing theories, Kingdon's theory, multiple streams framework, as well as the 3IE framework, which talks about how institutions, ideas, and interests, as well as external events, can help explain why you see particular health system arrangements and why you might not. So that's an explanatory framework. I also drew on a modification of the interactive systems framework that Abe Wandersman and colleagues created to help, and I'll show you later, to help describe intermediaries and what they're doing in systems. And again, I used the same integrated knowledge translation approach where I partnered with the International Initiative for Mental Health Leadership. So this leads me to insight 3, which is that there are at least 3 subtypes of intermediaries that exist that are playing this function. So you have a subtype that is really focused on that knowledge translation pipeline, taking evidence that's generated and ensuring that it gets embedded effectively in policy and practice. You have practice-focused intermediaries that are really focused on building strong relationships with the service delivery sector, and they're looking for problems that practitioners are and people who are getting services in practice environments are experiencing, and then looking to research governance, but also to innovation and co-design processes to problem solve. So they're really practice-focused intermediaries. And finally, we have policy-focused intermediaries. And these intermediaries tend to play a closer, have a closer relationship with government and tend to play a role helping to implement some of the large-scale policy directions that a government might have and want to achieve. So in some cases, government participants in my study talked about the intermediaries as their implementation arm. So it can be that tight of a relationship. So even though I'm distinguishing these three subtypes of intermediaries, it's important to know that probably each intermediary would have be doing a little bit of each of those three different types of activities that I described. And where the differences are would just be in terms of the balance and how much focus you would have on particular relationships and systems over others. So one of the questions that I had that related to where intermediaries existed in systems is why were they established? And so the first thing I did was went backward from the establishment of an intermediary across time and looked for the things that started to drive a system toward deciding that an intermediary was a solution to the problem of an implementation gap. And I did this, you don't have to read all of this, but I did this for each jurisdiction. So I had just showed you New Zealand. This is Ontario, where there are three intermediaries. One, the Ontario Centre of Excellence for Child and Youth Mental Health, the Provincial System Support Program at CAMH. Both of those are discussants today, as well as School Mental Health Assist, which is now called School Mental Health Ontario. And each of those were funded by a separate government ministry, but they were all working to improve mental health and working closely with their policymaker partners to do that across the system. And finally, in Sweden, I explored the intermediary called Mission Mental Health, which is part of the Swedish Association of Local Authorities and Regions. And again, they were an intermediary established and enabled through the national government to support service improvements in the regions and the local authorities. So my insight from doing that analysis is that in each jurisdiction, there was a unique set of problems, such as negative events involving people with mental illness. So for example, in Sweden, there was a death of a national minister, governmental minister, at the hands of someone who was experiencing a mental health problem. And there were a unique set of policies, for example, feedback on the effectiveness of existing policies. So in, I think, all three of these jurisdictions, prior to the establishment of the intermediaries, there had been a lot of headway made in on the epidemiological front, understanding the depth and breadth of the problem and the fact that it was getting bigger and not staying the same or reducing over time. So the systems were getting feedback that the existing policy approach was not effective enough. And finally, political events like changes in government. So in this case, for example, in New Zealand, there was a change in government around the turn of the century that really that put a government into power that was really willing to invest in mental health. And actually, I think in New Zealand, we are at another juncture there where they have a government who's, again, very willing to invest in mental health. And that can be an important stimulant in terms of creating the type of implementation capacity that we have in these systems. My fifth insight is that intermediaries varied greatly in their structure and characteristics. And so what I have on this slide is a long list of the ways that the intermediaries that I studied are different. What's interesting about this is if you're trying to find other organizations or programs that are doing intermediary work, it's not clear necessarily if you found another organization, because they differ in so many ways. So if you were at a cocktail party with a bunch of intermediaries and you were trying to find ones that were like you would probably have to go through a lot of differences to find that common ground. But what's really interesting about this is that it's kind of the know it when you see it sort of thing, that intermediaries, in fact, can find one another, and they do understand one another at a concrete level, because a lot of the ways that these intermediaries differ can change and do change over time as their funders shift in terms of their thinking about the issue. In terms of similarities, there aren't many. So 3 of the 5 in my study were about the same size, although we had one that was much larger at the time and one that was much smaller at the time. And they all received their main funding from the government ministry, so from their respective government ministries. So those were the commonalities amongst the intermediaries. However, one of the ways that they found one another is that they used very similar implementation strategies and also avoided similar implementation strategies. So that is my 6th insight. Again, this is a table, might be a little blurry in the WebEx room, apologies for that. But this is where I drew from Abe Wandersman's Interactive Systems Framework for Dissemination and Implementation, which I had modified as part of another study where I did a critical interpretive synthesis of the literature to add a policy system to that implementation ecosystem that he and his colleagues described so well. And essentially what I have on the following few slides is a table that outlines the target system according to Abe Wandersman's Interactive Systems Framework. So on this slide, we have the synthesis and translation system. So if you think about an intermediary, some of the things they do are about that synthesis and translation gap. And so I kind of subdivided their strategies according to the different target system. I then listed the implementation strategies that I asked them about because I had pulled these from the literature, or that they provided to me as part of the interview process. And then I cross-referenced them with Byron Powell's and colleagues' typology. So this was his first. He's now done some work since then. But what I really liked about the way that Byron and colleagues had developed this typology is they had kind of high-level categories such as educate, plan, that you'll see here. And so I basically am just cross-referencing what the intermediaries said they were doing with what we understand a common framework that's used already in the implementation science literature. And then each table just lists the intermediary, and the box tick is whether the intermediary in fact does that. Now, you could ask an organization where they do something and they might say yes, but it's hard to know to what extent are they doing that? Is there a positive response bias? So I did a lot of work to triangulate their answers with other sources of data. So when I did interviews, I didn't just talk to intermediaries, I talked to their partners, I talked to people that they were trying to influence in system, I talked to people with lived experience and family members. And so I used a variety of ways to try and triangulate these strategies so that we understand clearly what the intermediaries were doing. So you will see here that they all did very similar synthesis and translation system implementation strategies. The next slide talks about the delivery system strategies. And again, you will see that they're very common strategies employed. The box at the bottom is audit and provide feedback, which is one of the strategies that came from the existing literature on intermediaries. But none of the intermediaries did this to any great degree, the ones that I studied, which we found interesting, and I will explore that in a further insight in a couple of minutes. The next group of targets was the other support system infrastructure. So intermediaries worked with other intermediaries or groups and systems that were supporting systems change. They weren't trying to tackle change alone. They were doing it in partnership, which is a good strategic use of resources and systems. And the bottom section there is the policy system and the types of supports that they provided to the policy system. Finally, they I asked them about strategies targeting the public. And again, this is highlighted in blue because none of the intermediaries to any great extent did any public awareness education types of things. And again, I found this interesting that, again, across the board, none of them really did this, and I will provide some insights as to why I think and why they think they weren't really acting in that domain too much. And then I added a couple of targets, one being a lived experience in families. So this is almost direct to consumer types of things. So, what are they doing with people with lived experience, children, youth, and families to support implementation? And all of them did do some direct things. So they weren't necessarily working through service providers or other intermediaries, but doing offering different types of supports to better enhance that capacity in systems to support implementation. And then the final target is performance assessment and system monitoring, which again, when the intermediary activity is at a systems level, becomes an important function in systems. So my seventh insight is I explored why those two particular strategies were not being used by the intermediaries in my study. And through both asking the intermediaries and then analyzing the data according to that 3IE framework, we found 5 reasons why these two strategies were not being used. And they're listed here. So the first is their need to build and maintain healthy relationships with policy actors. And that specifically was around that public the public strategies. So if you are working closely with government, sometimes the public campaigns, the anti-stigma campaigns, especially if the government isn't investing heavily in those, can be problematic with for your relationship with them. So they were really sensitive about their relationship with their government partners, and they tended not to jump with 2 feet forward into that realm. The second is their need to build and maintain healthy relationships with the service delivery system actors. So audit and feedback as a strategy, first of all, often happens at a practice facilitation level, and intermediaries who are focused on at a systems level and doing this large scale systems change weren't necessarily focused on that granular a level in systems, but also audit and feedback the intermediaries when they were asked to do it by their government partners or others were reticent because it can be seen really not as an enabling approach, but more of a stick and a carrot and stick scenario. And they wanted to be seen as supporters and enablers and working with their service delivery partners instead of auditing and feeding back that data to them and to the system. So it might be how audit and feedback is described currently in the literature, that they're still doing some things at the system level that might look a little bit like that, but certainly they highlighted this as a key concern. The third is role differentiation with other system actors, and this is again around those public strategies where anti-stigma campaigns and other things like that, often there were just other organizations that were already doing that or were more well placed to do that in systems, so they just felt they didn't need to do it. Fourth was a lack of fit with the role of policy intermediaries. So both the public and the audit and feedback strategies, the intermediaries didn't necessarily think they needed to or were tasked with doing those roles. So some of this was how they were initially funded, what role they were meant to be playing in systems, where they thought their biggest value add in systems was, and they didn't see those two particular strategies as being a huge fit with their role. And the fifth, as I sort of alluded to when I talked about that practice facilitation level, is just that there are resource limitations when trying to work at scale. So if you're working at the scale of a country, you're working across a geography, or even in Ontario, which is larger than those 2 other countries, with 13.5 million people, it's very difficult to do that intensive distributed program or clinician level work, and so it just didn't fit. It couldn't be done with a reasonable amount of cost. And again, where they thought they could add the biggest value was elsewhere. Okay, so moving on to Insight 8. These insights are more of what I think are my reflections and lessons learned from those findings that I thought would be important to share. So my last three are really more of food for thought and discussion. So my Insight 8 is and it's more directed to policymakers and implementers, but when looking to build implementation infrastructure, policymakers and implementers should make explicit choices, both in terms of the design and with appropriate consideration of the political system context, in addition to the health and social system context. So context really matters. As you saw in my first study, past policy decisions create certain capacities in systems, and it will be easier for you as a system to enhance existing capacity than trying to build it from scratch elsewhere. That's one example of how that might play out. And they must also pay careful attention to the role of other actors in the system to ensure that intermediaries add value and are optimized to work with those other actors effectively. So that support system infrastructure where you have kind of a collective impact approach, where you're collaborating with others who are doing a piece of that implementation continuum is critical. There is not one organization or program or individual who's going to make change on by themselves, as we know. And so really to be placing these intermediaries and enabling them to be able to collaborate well with other partners and systems is critical. And they all spoke to that. Insight 9 is again directed at policymakers and implementers, but they should be make active decisions about the implementation strategies they intend to employ and monitor their use and effectiveness. So I created that list of strategies from the small but growing literature on intermediaries. I also took them from the practice level strategies where the focus of implementation science has traditionally been. But I do think that perhaps what happens with intermediaries is they're focused on the broad goal of systems change and maybe aren't as intentional as they could be about what strategies they're employing and when they're employing particular strategies. So I think that that's important. And it's equally important to consider the vehicles through which these strategies are delivered at scale in systems. So the intermediaries talked a lot about the centralization versus regionalizations of their models, what works best, what do you gain and lose under different scenarios, and also, these strategies become vehicles for change in and of themselves within an implementation intermediary. And so it's really important to think through both what strategies are using and how are you deploying them in systems to get the maximum benefit for people and families. And finally, there's no need to develop infrastructure from scratch. And I've alluded to this throughout, but there are some studies in the literature that you can find, and hopefully I've published one and I'm working on publishing my second, and hopefully there will be even more in the future. There's been a couple of great papers that have come out recently by some of my American colleagues. So we're learning more about intermediaries, but there's also an opportunity for jurisdictions to learn directly from one another through structured knowledge sharing opportunities. And so in the mental health world, there is my partner for this for these two studies was the International Initiative for Mental Health Leadership, but also the Society for Implementation Research Collaboration, or CIRCS, has an intermediary network of excellence where you can connect with others who are doing that similar type of work. And collectively, I think there's a large opportunity there to forward the understanding of this type of function in systems and also how to optimize it through these different types of venues. And the goal here is really to if we're going to invest in things that are not direct service provision in systems, and I firmly believe after these two studies that that's an important thing to do, we have to think about how to do so in the most efficient and effective way possible. And one of the ways to be efficient and effective is to learn from others that have come before or have been doing this work in different fields. And that is why I think it's really important that we build on and from other intermediaries' knowledge. So I flew through that. I will now take a breath And I'd like to introduce our discussants today. Alexia Jaouich, as Steve mentioned, is a Director of Implementation and Innovation at the Provincial System Support Program at the Centre for Addiction and Mental Health in Ontario. You can read there about how amazing Alexia is as an individual and the types of expertise she brings to her role into the system in Ontario. And also, I'd like to introduce Purnima Sundar, who is the Executive Director of the Ontario Centre of Excellence for Child and Youth and Mental Health. And again, I've given you a very short bio there to also talk about how amazing she is and the expertise that she brings to her role and to Ontario's mental health and addiction system. So I want to welcome both Alexia and Purnima to this webinar. And I thought what I would do is ask them to each respond in turn to a question. So we're going to start with the first question. And the first question is, and I'll start with you, Alexia, what is your top lesson learned from participating in this research? So what about this research resonated with you, or what in terms of the findings was of interest to you and your colleagues at PSSP?
Thank you, Heather. I'm just going to do a quick check. You can hear me?
You sound great.
Hello? Yeah, okay. I wasn't sure. So thank you for inviting me, and I gave some thought to this over the last few days, and I think overall just some overarching statements is that participating in this kind of research and reflection has been immensely helpful for our program overall, being a program that is busy with implementation, that the time to reflect and learn what literature is saying, considering what others are doing isn't always part of our allocated time. So being part of this has been very helpful to reflect on our work. I think a couple of specific takeaways is one of them is the more explicit consideration of policy. So we've been doing some of this work for a while, 8 years now or so, with policy involvement, but not necessarily always thinking about it explicitly. So it's led us to think through how we support a policy development, feedback loops, in terms of our implementation work and the work that's happening. How do we connect in with policy? How do we consider it more explicitly, provincially, but also locally, right? So in that local implementation piece, what are the local specific policies that need to be taken into consideration and impact the work that we do? So it sounds like a big bucket piece, but it's a kind of a very was very important for us. The other piece I would just want to mention is what's been very helpful and some of the lessons learned is the diversity of intermediaries that are out there. And really looking at how they're configured, their focus, and seeing both similarities and differences has been both validating and made us kind of question some pieces, doing some of that self-examination, reflection individually, but also as a program. We've been able to talk through some of these questions that you've posed through your work and what's been learned in other jurisdictions to kind of fuel our learning and our improvements as well. So that would be some general takeaways.
That's fantastic. It's exciting for a researcher to hear what resonates and what their partners think is salient. And, I think I was really driven to doing the research to unpack that role of policy. So to hear that's been helpful to you is music to my ears. But Purnima, did you have any insights on your top lesson learned or what resonated with you the most?
Yeah, and again, thanks very much for having me here on this session. It was really, I would echo everything that Alexia said about how validating and being it was to be featured in this research. Really took that time to do oneself.
Purnima, you're breaking up. Is there a way you can go a little closer to the mic?
How's this?
I think it's better.
It's better? Okay. So what I was saying was that it was really, validating for us to feel like the things that we're doing resonate with others. We're trying to achieve similar ends. So just in terms of, I'm not sure about the audience and how much you know about our Center of Excellence, but we really do have a very focused, fixed mandate on Ontario's community-based child and youth mental health sector. And our mandate has always been around supporting evidence-informed service delivery, which feels very broad, but also very specific to the audience. So what's been validating through this process is, first of all, being connected to an international group of people who are either doing similar kinds of things or who see the value in doing things that we've been doing them in Ontario. And so the opportunity to both share but also learn from one another. I would also say that it was really validating because, working with SSP and also other intermediaries like School Mental Health Ontario, it really does feel very, I feel a lot of pride to say that we were given these very loose mandates or directives from ministries to, make sure that the sectors we work with are using evidence in the right way to produce good outcomes for families. So we sort of carved our way forward, and it seems like it's making quite a bit of an impact. So I would, there's a lot of pride. There was a lot of really feel like in our fields we don't do a whole lot of tooting of our own horn, and this gave me an opportunity to really step back and say, you know what, we're all collectively doing some really neat stuff that we can share, but also we can learn from others on how to strengthen that.
Excellent. So I heard there that some of this was a good validation for you, that what you were doing made sense and could be put in kind of a framework that was understood by both your organization and others, and then also that idea of being able to kind of say, yes, this is an important function in systems, and here are the specific things it's adding value and the ways it's adding value. So that pride piece. Okay, Alexia, so back to you for the second question. What research would you, this is of course to help feed my research agenda, but also anyone else who might be on this webinar or listening to it later. So what research would you like to see, or what research would be helpful to you and other intermediaries in the future?
Yeah, good question. Again, it made me kind of think that through a little bit. I think there was kind of two categories that I was thinking through that would be really helpful. And it's been part of us being a very kind of practical, operational program, right? So a lot of our work, most of our work is very active, active implementation. We get a project assigned to us or co-develop with community, and we go pretty quickly. So in that kind of practical realm, there was two pieces that I thought would be really helpful. One is you talked a lot about the strategies that most organizations use, or what's in common, what's different. And I think part of what I would keep thinking through, and we talk a lot about in our program, is what strategies for what tasks, or when which strategies. So a bit of consolidation of our intermediate organizations, focused on more of some strategies in the early stage of a project versus when they're at initial implementation, quote unquote, or when they're working with different types of stakeholders. So a bit of a differentiation there around the strategies, which ones for what, when kind of questions. And then the other one was something that I think we've learned over time, and some of the work that the National Implementation Research Network has done around they did a practice profile, so a bit of a description around what an implementation specialist might be, is what are those skill sets that are necessary across a varied organization like ours around what types of skill sets do people working within this kind of program, what do they need, what is beneficial for them to come in with, what is coachable, teachable, what can be supported, and a bit of that, like, what's the workforce here that is really key to doing this kind of work, both at the leadership level, management level, staff level, etc. Are the two kind of practical questions I keep coming back to.
That's great. So I heard unpacking strategies and refining our understanding of them so that we can really, again, be clear about what strategies are useful under what contexts and when. And then also understanding what is that individual level capacity that we need to make this concept of intermediaries really matter is the people. And so how do we ensure that we're recruiting the best people, training the best people, and to do to use those strategies effectively. So yeah, and that I think is still, I can see why that would be a challenge. And also I was thinking as you were talking about some of that intermediary as an individual. There's a paper that came out from the UK recently that talks about intermediary capacity, but at an individual level. So I wonder if there are some places that we can start, and some folks that we can start having conversations with about that. Just an emerging thought as you were speaking. So Purnima, same question for you. What research would you like to see, or what research would be helpful to you and other intermediaries from your perspective?
So can you hear me now, Heather?
So much better.
Okay, good. So I think that one of the things I would echo is around Alexia's comment related to workforce. And we have grappled over the last several years with a number of different kinds of positions. We haven't had an implementation specialist on staff. We have had roles that are fairly new and fairly, I would say, have been built from the ground up, like knowledge broker or coordinator, that kind of thing. And so what I would say is that's certainly an area, and I think that I see Paula Robeson's name on this participant list, and she's worked many years ago looking at, what are the critical elements that are required, in somebody who's working in the space between research and practice, and how do you actually hire for that kind of role? How do you train for that kind of role? How do you, how do you evaluate that kind of role? So I would say the workforce stuff continues to be on my mind, and so learning a bit more about what others are doing. We've done quite a bit of connecting across a number of our organizations, both provincially and nationally, to learn from them, including as we were developing our own workforce, different roles. We collaborated with you folks at PSSP. We collaborated with some national bodies as well, Mental Health Commission and also CCSA. And so I think that, learning from one another, talking a bit about what that process is like, but really, adding together to the growing literature on what it is that, are the critical ingredients to these kinds of roles that facilitate research to practice, I think would be one area. I think the second area would be around impact for me. So we all do similar kinds of things, many different things, all to similar ends, and the similar ends are really very broad. So it's closing that research to practice gap, right, and making sure that we're producing good outcomes for whoever our target audience is. And I think, when we met recently through the International Initiative for Mental Health Leadership, that was really helpful in getting us started around thinking through a theory of change. I think that to actually more research behind that and try out, potentially testing would be a really, really important contribution. That would be very helpful moving forward.
Great. So you came in and out a little bit there, but I heard another vote for workforce and the strong need to really understand that element of the work much better. And then I heard that the need for clarifying impacts, theory of change. What should we expect these types of organizations or programs to achieve? How do we measure it? How do we benefit from others' understandings of impact? I know in New Zealand, they had taken a stab at doing, for example, a contribution analysis of their intermediary, and having some economists weigh in. What is the contribution of the intermediary to the overall impact of the policy or systems initiative? And it's a challenging thing to do, but the more we can innovate and understand how to measure those things better, I think the intermediaries will be in a better place to make a case for why they need to exist. So thank you both for that. We've got about 9 minutes left. So what I think Steve will want me to do is tell me, Steve, if you want to moderate the questions or how you want to manage this part.
Yep, absolutely. We've got a couple of questions that have come through. So the first question is about what kind of KT tools were used by intermediaries in different countries observed, and where there were commonalities between them, where there were some tools that were more commonly used. And the second part to this question is when can we expect to read your research paper?
Great. So one of the papers, the one that sort of looks at the placement of intermediaries and the explanatory framework that I drew on for that is out. And my thesis is now available in the National Library Archives, except for that it's embargoed because I had to get permission from a journal to post it. So if you want to read the chapter, I'm happy to provide it. It would be even better if I can get it out for publication, my second piece here. So that's that short answer there. Contact me if you want, or contact the forum and they'll put you in touch with me around if you want to read my chapter and get all the details. Happy to share it. It excites me when people want to actually read something like this. And I will be working industriously on my publication. In terms of the KT tools, so I'm going to interpret the KT tools broadly to mean not just tools focused on push, pull, linkage, and exchange, but those also focused on actively supporting organizations and people in organizations to make changes to either align with the evidence-informed policy or an evidence-informed practice. I would say that all of the intermediaries started at a different place when it came to KT tools. So some of them were more on that push strategy, dissemination focus, let's understand best practices and share them. Let's hear what evidence people want to know about and make sure we can get it to them. So bridging that gap between the knowledge that exists and having the people who could use it be aware of it and tailoring it in usable formats. So some started there. Some started on the ground. If I think about Sweden, they started really on the ground with different organizations to respond to the local and regional priorities that existed for mental health. And then they kind of built backward into, okay, now there's some lessons learned that are bubbling up from these, different regions, and we can put together some products that will be helpful to the rest of the region. So they kind of reverse engineered it from that perspective. So there was maybe more of a ground up approach, which meant that their strategies and activities were often not planned, but were built in response to the local needs. And then with that approach, you have challenges around standardization. So depending on who you had servicing a particular region or local authority, they might draw on their particular skill set. And this comes back to the human resources planning that both Alexia and Purnima spoke to. And so you had to, at a certain point, reconcile what was happening locally with describing yourself as a program nationally. But if you do too much the other route and go top down, it often isn't responsive enough to the local needs. And so I think one of the finesses of intermediaries is finding that balance between developing shared and common approaches and tools and resources that they can draw upon and that are understood at scale in systems, but also being very locally responsive to very urgent local needs, and then having their eye to what did we learn from that might be useful for others. So I would say that they ended up over time in more similar places, but their starting points were very different. And some of that had to do with their mandates and the urgency with which they were developed. And probably some of it was cultural, although I didn't study that. I hope that helped a little bit.
That's great. Thanks, Heather. And then another question actually around KT tools, which, again, you can kind of interpret maybe a little bit more broadly. And I know you sort of addressed a bit already, but in terms of future research, has there already been studies conducted about KT tools used by intermediaries that are most effective, or in terms of what works best, or do you know if there is research going on in that area?
There has been some descriptive work on tools and strategy. I'm going to call them strategies, though. So Byron Powell and colleagues, Enola Proctor, have done a lot of work. Enola and some colleagues just did a paper where they looked at, in implementation science, where they looked at the different intermediaries supporting child and youth mental health services through the SAMHSA database, and did some description there as well around tools, and they surveyed them. So there is work happening. I think what's interesting, and part of why I didn't do, even though the US is part of that International Initiative for Mental Health Leadership, why I didn't study a state or a jurisdiction within the US is because there's less known about the implementation support infrastructure in other countries. And so part of what I was trying to do is balance the American perspective, because they have particular, as we all know, health and social system arrangements that are unique globally. In some ways, some of the other jurisdictions in the world are more similar to one another. I would say that there's some great work happening from teams in the UK, not necessarily some of it in mental health, some of it health and social care, and some of it more specifically around the Clarks, as an example, from healthcare more generally. That has been excellent and continues to be happening. So that's another group that has done a ton of work. That's or groups that have done a ton of work that's worth looking into.
That's great. Thanks, Heather. And just to kind of go back to the first question a little bit, if anybody is interested in getting Heather's publications or research, yes, certainly feel free to contact her directly, or you can email us at forum@mcmaster.ca, and we'll be able to put you in touch with Heather or pass that on to you. We're almost out of time today, so I just wanted to say thanks again to Heather, to Alexia and Purnima for joining us for this webinar. It's been some very interesting insights and great discussion. So thanks everybody for attending. Thanks again to Heather, Alexia, and Purnima. And I would encourage you to our next series of webinars. Our next one is in December. And we'll certainly be having more webinars every month during the new year as well. So I encourage you to check out our website to see all of our upcoming webinars, and hopefully we'll see you again soon. Thanks, everybody.
Thank you.
Thank you.
Thanks, everyone.